Let me thank the Koch brothers, of all people, for sponsoring a study that shows that Medicare for All would save the American people $2 trillion over a 10-year period.
Nigga, get the fuck out of here.
That's right. Bernie Sanders is taking a report on his Medicare-for-All plan, which is estimated to cost at least a whopping $32 trillion, and running with it, which is hilariously stupid. According to Bernie, the report estimates that his Medicare-for-All plan will cost $32 trillion over 10 years, claiming that it will save Americans on healthcare costs. As you can see, he's made a video about this and tweeted his endorsement for the Mercatus report. So there's no going back here. Bernie is proud that his plan will cost $32 trillion over 10 years. Apparently, this figure is merely chump change to Bernie. But first, it's important to note that Bernie's collectivization of wealth and false dichotomy need to be rejected up front. What Bernie and his Menshevik goons are doing is two things. One, they're collectivizing wealth. And this is how they honestly see and think about wealth, as a big pot of gold that belongs to everyone. They don't see your money as your money, or your dad's money as your dad's money, or your grandma's money as your grandma's money, or my money as my money. No. They see all money in America as society's money. This is the way they frame their argument. America, i.e. we, will save money on healthcare costs. Isn't this the fiscally responsible way to go? Shouldn't the priority be the American collective and reducing society's burden? And because of this, Bernie and his Menshevik goons are able to present this false dichotomy. We can either do what we're doing now and pay more in the long run, or go with Bernie's plan and save billions, perhaps even trillions of dollars. And let's be clear about the modern healthcare system. It's not capitalism. It's a mixed market. It is a combination of private insurance, private clinics, private pharmaceutical corporations with strict regulations and massive subsidies. What Bernie and the socialists don't want anyone to consider is the logical alternative, which is complete privatization of healthcare and insurance. Now, the economic argument for privatization is irrelevant because, after all, it's Bernie that's making the economic argument in this case. Bernie is the one saying that his plan is more efficient, less costly, and what have you. But as you'll see with the report, not only is Bernie laughably wrong on the economics, but just like 19th century Democrats, he's using economics to justify slavery. First off, the report admits numerous times that the $32 trillion figure is a conservative best-case scenario and that it's very likely to be an underestimation. The $32 trillion football that Bernie is running with was calculated based on aggressive estimations where everything runs as smoothly as possible, as the author hints numerous times. One notable case is the aggressive estimation of reducing administrative costs by 7%.
It will do that by substantially reducing the administrative costs.
It is highly likely that it will cost well more than $32 trillion over 10 years. Bernie must have overlooked these details.
Oops.
Secondly, Bernie's plan requires price fixing.
Well, that just sounds like slavery with extra steps.
And this is by far the most outrageous aspect of the plan. Telling people that they're not allowed to sell their goods and their labor on the free market at prices that they find desirable is slavery. In order to reduce the cost of care and drugs, the government needs to tell the care providers and the drug producers to sell their labor and their goods for less money. Are you seeing a Medicare patient? Make sure to give them a 25 to 40% discount. Who do you greedy doctors think you are, charging whichever rates you wish? Hopefully this does not result in hospitals losing money. Oh wait, but don't worry. This will save Americans money. Where have we heard this before? Oh, that's right, anti-abolitionists who stressed that slavery was great for the economy. After all, Americans should not be burdened with higher textile prices. Cotton farmers need free labor. Or think of this as the minimum wage in reverse, because the goal is to reduce costs by setting a price ceiling on services. So apply this logic to the automotive industry and imagine Bernie Sanders saying that we need to make cars more affordable, therefore assembly line workers and auto dealerships need to take a pay cut in order to reduce the cost of a car. It's the same logic. And sure, Bernie's plan does not explicitly put doctors and pharmacists in chains, but imagine being told that you're not allowed to sell your work or your property at the highest possible price. So greedy.
If we can get rid of the profiteering, the dysfunction, and the incredible waste within the current healthcare system, if we get rid of the advertising and the high-priced compensation packages of healthcare executives, we can save hundreds of billions of dollars each and every year.
Now, it does not take someone with a PhD in economics to conclude that price fixing will have disastrous economic effects, as even noted in the report. It's impossible to estimate the loss of innovation as a result of price fixing. You're going to get less people wanting to work in medicine, and along with that, shittier, more miserable doctors and pharmacists. Without a profit motive in the market, what incentive do people have to create new medical technology and drugs?
Zero.
And of course, even with the price fixing, the report admits that the $32 trillion figure is likely an underestimation. The various charts in the report even reflect the mandatory price fixing. Without the price fixing, the plan would cost as little as $38 trillion over 10 years. And this is all additional spending, i.e., on top of whatever the government already spends. In 2017, the federal budget was just over $4 trillion, $500 billion of which was borrowed, meaning that the federal government already can't afford the current expenditures at roughly $4 trillion, and Bernie's Medicare-for-All plan would nearly double the budget. As the report that Bernie is running with claims, doubling the individual and corporate taxes alone would still be insufficient to pay for it. In other words, Bernie's Medicare-for-All plan would enslave workers in the healthcare industry, would force every American to pay ungodly amounts more in taxes, and it would destroy the quality of healthcare in America.